Great to have you all with us and welcome. I'm Ingrid Barker. I'm Chair of Gloucestershire Health and Care NHS Foundation Trust, and it's my pleasure to chair this session this morning. So thank you for joining us for this member showcase presentation. If you've been at any of these sessions earlier in the week, you'll know that this is the part of the programme where we highlight some of the really great work going on in some of our trusts across the country. And today we're delighted to welcome East London NHS Foundation Trust to share with us how they have been using quality improvement methodology to address the work-life experience of people working in their organisation, particularly ethnic minority groups and people facing difficulties at work. So in a moment, we're going to watch a short video and then we'll be hearing from our speakers, Tanya Carter, Adrian Curwen and Jemma Ball, and you can see their roles on the screen in front of you there. So I think we're probably now ready to see the video. Let's go.
Staff experience is one of the 4 key pillars of East London Foundation Trust's strategy. However, in 2019, the Trust had a disproportionate number of staff suspensions and work to do on the Workforce Race Equality Standard key indicator. Relative likelihood of Black, Asian and minority ethnic colleagues entering a disciplinary procedure. The Trust used quality improvement methodology to address the work-life experience of staff, particularly ethnic minority groups and staff facing difficulties at work. Their interventions included HR role design, training, policy change, and introduction of a fair treatment processes. They also introduced a Trust service user to act as an independent consultant to anonymously review the Trust's employee relations cases, particularly where mental health could be a factor. The project proved successful, as the Trust now has significantly fewer employees suspended, fewer disciplinary cases ending in no case to answer, and a significantly improved Workforce Race Equality Standard score. It is hoped that more staff will sustain their employment and thrive in their role, thereby ensuring consistently high-quality services for patients and service users.
That was fab. So participants, please do use the Q&A function at the bottom of your screen if you'd like as we go through the session, or put your hand up. But meanwhile, I'll hand over, I think, first of all, to Tanya. Over to you, Tanya.
Thank you. Good afternoon. My name is Tanya Carter and I'm the Director of People and Culture from East London Foundation Trust. Next slide, please. So I'm going to talk to you about our project, Compassion and Employee Relations. Next slide, please. I'm also joined with my colleagues, Adrian and Jemma, who will introduce themselves when they speak. So as you'll see in the video, it talks about our trust strategy. And this document you can see is our people plan, which is aligned to the trust strategy. And the overarching aim of this was to improve the experience of our staff. So we've done a range of work across a number of the key priorities, but this project was focusing on the disproportionate amount of BAME staff going through the formal disciplinary processes. And what we found in 2019, there were a number of cases that the misconduct was a result of mental health issues, or as a result of the process taking too long, people became unwell in the process. And so what we try to do is apply the usual ELF formula in terms of QI through our methodology, but also co-production. And that's where we involved our service user, Adrian. A couple of other things that we did was around surveying staff who had been through the process to understand whether or not they had had a positive experience. We used QI methodology to reduce the length of time that disciplinary cases took. Next slide, please. So using our driver diagram, we did implement a number of interventions. I think the most notable is the fair treatment process, which is where we triage disciplinary cases to determine whether or not it should proceed to formal disciplinary action. revised our policies and training for our HR staff, the service user review, which Adrian will talk about, the survey I've mentioned, and we're also currently rolling out respectful resolution to see how we can further reduce formal and informal cases. Next slide, please. And Adrian, it's over to you.
Hi everyone, so I'm Adrian Curwen, a service user, someone with lived experience, and an honorary member of the People and Culture team. Next slide, please. So the Trust Investigations Lead helped with impartiality by having someone solely dedicated to only doing investigations. Then the next post was the start of the People Liaison Officer, whose sole purpose is to work in pastoral care. And then we just looked at reviewing how we did with medical ER. And next slide, please. So just got quickly just a couple of points of feedback. With the People Liaison Officer, one particular feedback that was sent to the department was from one particular member of staff who lodged a complaint of being bullied. She was saying that the very first welfare call that was made to her made her feel so, quote, humbled by the extent that her employer showed how much they actually care for their staff. And, quote again, I was filled with tears of joy. And I remember that I became more tearful that we could not discuss much more. And then she mentioned about each week she received a call, just checking in and kind of giving comfort and soothing support. And as well as just giving support by telephoning, she was also directed to, quote, well-researched support groups and websites where she could use other resources which have provided her tremendous support in kind. And for my involvement, my kind of feedback, two quick cases that I kind of gave feedback on. In one particular case, the Trust had done great by really trying to be supportive and accommodating of the particular employee. But there were kind of issues that came out of that. And kind of my feedback was that I thought that it came a stage where the adjustments were beyond what was reasonable, to such an extent, and this was a member of staff on the ward, that myself, if I was a patient on that ward, I would be really worried for others receiving the service from this particular member of staff who had their training adapted significantly. They're basically the one up to date with current training. Another quick case was the focus the Trust had on staff attending workplace meeting. And in particular, I kind of thought that if you're supporting a member of staff with long-term absence and someone that has a mental health condition, I think quite often the employer ELF may not particularly realise and appreciate just how difficult attending a meeting is at your place of work. Because often, I mean, just taking a shower or leaving the house is a huge thing to try and do, and kind of the basic life task can be challenging with depression or anxiety. So what a couple of ideas that kind of came up with was meeting them somewhere neutral, either in a cafe, confidentiality, but where that person doesn't have all these negative thoughts coming back to them attending a meeting at the workplace. So just kind of finding neutral territory. And that's it for me. Next slide, and I'll pass you to Jemma. Thank you.
Hi, thanks, Adrian. So I'm Jemma Ball. I'm Deputy Director of People and Culture at ELFT, and Employee Relations is one of the services that sit in my portfolio. So I had a real vested interest in this project and how it delivers. Next slide, please. So as Adrian has illustrated really well, the key aim was to make a difference to staff experience at work and really the impact that a HR process can have on an individual's life and how they feel about their job and work going forwards. But apart from that, we wanted to take some real key actions and deliverables that would make a difference to how we deliver our service. So following up on Adrian's feedback and his recommendations, we made some real tangible differences to the service. So there was a piece of work to do around the letters that we send to staff and coaching managers around that. So the team were in the habit of providing a very employment law sound letter, but not sort of skirting some niceties around the edge of that and giving the personal touch and coaching managers in how they can do that a bit better. As Tanya outlined, we had a look at the job design within our employee relations team, and we've tried to move away from the traditional model of HR managers and HR advisors. And as Adrian's outlined, the investigations lead role has been really key in bringing consistency to the quality of investigations and whittling down the time that those processes take as well. But most importantly has been the impact of the people liaisons post, as Adrian says, and giving that personal touch and making sure that people are kept in touch with throughout what's quite a difficult and stressful process. And as a team, we talked about our culture, and the fear of litigation actually really affects the way we give advice. So we talked about how we can put the person first and take a much more person-centred approach around just culture and thinking about what's best for that individual and best for the organisation, and sometimes just putting the policy and the employment law back in a drawer and taking a slightly more personalised approach. Next slide, please. So all those familiar with QI will know how important the measurables are, and having some measurables were really important for getting all of our stakeholders on board, so be that managers involved in these processes or the trade unions. So you can see there that the impact the work has had. So we started early 2019, so we took our baseline data from 2018, really set out what we wanted to impact on, and have been measuring going forwards the impact on those KPIs. And actually our RES score last year came down significantly, again to 1.78. Next slide, please. So that shows you there the impact that we've had on the RES standard. So that was really our key goal, to impact that particular metric on relative likelihood of BAME staff entering a formal disciplinary process. So we're really pleased with the impact that we've had there. Next slide, please. So although the project's closed and moved to business as usual, we make sure that we continue to measure our impact, and that goes in every board report, and we measure monthly what our employee relations case activity looks like. And you can see there that it's a consistent close of the gap in terms of BAME staff going through a disciplinary process in comparison to their white colleagues. Next slide, please. So that is over to Ingrid for any questions that might want to come our way. Thank you.
Fantastic. So thank you very much indeed for that real whistle-stop tour. Are there any questions? I'm not seeing anything in Q&A at the moment. So do post your questions there, or raise your hand if you would like to ask any questions of our panel. While you're having a think, there were 2 or 3 things that I wanted to ask. One was where your freedom to speak up process fitted in with this, particularly in relation to your people liaison officer. Are there overlaps, or how do you navigate that? And for Adrian, I thought the insights that you brought to your review were fantastic, because they just offered a really different perspective, and I could see that if I'd been in, I don't know, Tanya's shoes, you would have been offering me something that would have been looking at the world from a different angle. And that was really useful to hear, and shows the value of the input of experts by experience into these things. Yeah, so just a couple of ones from me to get us kicked off. So yeah, do you want to come back on any of those while we're waiting?
Yeah, sure. I'll start with the freedom to speak up query. So there isn't any direct connection with the freedom to speak up guardian or the liaison officer at the moment, but that's something for me to explore. But I do meet regularly with the freedom to speak up guardian and chief nurse, and we go through all of the freedom to speak up cases. I also meet with staff side, and we review any themes by place, by issue, and we do feedback the themes from the liaison person. But that's probably something else to explore with the guardian.
So that's something that one of the other questioners, Sarah, has flagged as well. So we'll come back and check it this time whether there's anything she'd want to follow up on that. Somebody else has asked Sarah again, actually, can I confirm, is the people liaison person employed by the trust?
Yes, they are.
And then Yasmin is asking what metrics are reported to the board that reflect staff well-being as a priority. I think this is something that's on all our minds a lot, given the health and well-being guardian role and some of the expectations around that. And anything you'd like to comment on around that question?
Yeah, if I make a start and then Jemma can add. So basically we take a people report to every appointments and remuneration committee, and we have detailed discussions about people. We also have a detailed people report that goes to the board. So the board have oversight of everything people, so our staff survey results, the ER activity, our wellbeing metrics, any initiatives that we've had, the take up of those initiatives. We also report on everything people, every metric we have, the board have sight of it. Jemma, is there anything you'd like to add?
It's digressing slightly from metrics, but something that the board does do to create a little bit more space is use an informal lunchtime session outside of the formal board agenda. So work like this and other staff wellbeing work can fall into that space as well, and it just allows a little bit more discussion time with those stakeholders to create awareness and raise the profile of some of these things. So that's something I found quite unique at Elft that works really well in terms of how the board use their time on board meeting day.
Okay, and there's another couple of questions come up. One from somebody that wants to know if there was any resistance from colleagues about having one person overseeing all investigations.
Sorry, Jemma, you go first and I'll add in.
I'm going to say no. I think actually there was a lot of appetite from the business, because anyone involved in this work will know no one ever steps up to be an investigator. So the more support you can put around that, the better, I think. The unions didn't particularly push back. They were just really interested that we measured it well and showed what impact we were having. And with the respectful resolution work and encouraging more informal conversations, they're just really concerned that we don't remove any formal process or policy where it's really needed. So they were the two pushbacks that we got.
The only thing I would add to that is this investigator doesn't do all investigations. It was to build capacity and to help with training and to have that oversight. So they don't all go through that one person. It's just to help where because we have a lot of investigations at any one time.
Yeah, and I think you commented that one of the things that's really difficult for people is the time that these things can take. So yeah, developing the capacity to do the thing at pace where it's needed is really important for everybody, isn't it? There's another question about the role of the staff side and unions in the work that you've been doing. How have they been involved?
So we work really closely. So again, we take lots of data and metrics to staff side. We have great relationships. So if they are concerned about a particular area or a particular manager, they'll pick up the phone. And it's fair to say when the Guardian role was first introduced, there was some resistance from staff side colleagues. I think they saw it as a blurring of roles, but actually as we've gone along, we're probably 2 or 3 years in, there's a role for all of us, and we work really closely together and triangulate what we're hearing from different places. And there are things that might go to the Guardian that haven't yet gone through staff side, and vice versa. So we do check in to see what we're hearing from staff.
Okay, thank you. I'm not seeing any more questions, and we are actually at the end of our 20 minutes. And what was really striking to me was the culture around all of this. You've been quite daring, actually, yeah, I think very open in the way that you've addressed this thing. So it speaks volumes for your QI approach, which I've heard about in other contexts as well. So hats off to you, and thank you for sharing the learning.
Thank you for having us.
So that brings to an end our sessions for this morning. So thank you all to our speakers and to our questioners.